Does hypertension affect only a certain age group, as in above 30, above 40, or can it also happen in younger groups?
So this is, I must say, is a myth.
And then is also hereditary contributing to hypertension?
Patients having their parents diagnosed as hypertensive at younger age are at higher risk of hypertension. So many times hypertension is diagnosed when patients are coming for routine health checkup.
Are there any other changes we can do in our lifestyle or diet that can aid management of hypertension?
You should have reduced salt intakes. I'm telling reduced salt, not totally giving up salt. Many times it has happened that patient has totally stopped salt eating and they start getting delirious. We always blame salt, but excessive sugar intake can also cool water and sodium in body and can cause hypertension.
Hello and welcome to Heart Talks, where we talk about expert insights in simple words so that you can take charge of your own heart health. Today we are here to discuss about a silent killer, also known as hypertension or high blood pressure. Why it is known as the silent killer, how we can manage it, etc. These questions will be answered by our expert interventional cardiologist, Dr. Rishi Bhargava. He has been practicing for over a decade at Kharghar, Navi Mumbai. Doctor, firstly I want to ask you, what exactly is hypertension?
First of all, Shreya, thank you for having me. And today what we are going to discuss is a very important topic, especially in context of our Indian scenario.
Right.
Hypertension, in simple words, is high blood pressure. Our blood pressure is supposed to be in a particular range. To be very specific, it should be less than 130 by 80.
Okay.
Optimum blood pressure is 120 by 80. Whenever blood pressure breaches this range, it is more than 130 by 80.
Right.
We may call it as hypertension. However, there are some classes or categories. We have divided hypertension into various classes based on the readings.
All right. And does hypertension affect only a certain age group, as in above 30, above 40, or can it also happen in younger groups?
So this is, I must say, is a myth that hypertension can only affect older patients. These days we see in our practice a lot of patients who are young in age and suffering from hypertension. Also, there are some causes of hypertension which can give rise to high BP right during the pediatric age group.
Oh my God.
So we should be aware about our BP, right?
What exactly are these causes then that lead to hypertension?
Right. So this is actually a big discussion. I would like to take some time here.
Yeah.
So when we diagnose a patient as hypertensive or a patient of hypertension, we divide that into two classes, primary and secondary. So primary hypertension, we also call that as essential hypertension. So essential hypertension is something which we don't find any specific cause. When patient has got hypertension, we have to treat that.
Right.
More important here, related to your question, is secondary hypertension. So secondary hypertension is something where we have got some cause. There is some pathology inside our body which has given rise to hypertension, and it is important to know that because if we treat that cause, hypertension may go away forever, right? So when you talk about hypertension in pediatric age group, what we discussed, there are some pathologies such as some tumors, such as some blockages in heart blood vessel, which is known as coarctation of aorta.
Right.
These are certain pathologies which can give rise to hypertension right during the pediatric age group.
Right.
Also, in younger age, very commonly we find secondary hypertension. The causes may be thyroid or any endocrine abnormalities. Thyroid is one of the commonest. Another issue can be tumor of adrenal gland. What is adrenal gland? So our kidney, on top of that there is a small mass which is normally present in all of us.
Okay.
It may sometimes have some tumor. So what it does, it starts producing something known as various adrenal hormones in higher quantity, in excess quantity.
Right.
And our body is not used to it. So our body starts developing hypertension.
Right.
Similar way, there can be some tumors involving kidneys. There can be blockages in kidney blood vessels, which is known as renal artery stenosis. So these are some causes which can give rise to hypertension, and
Right.
that situation we call that as secondary hypertension.
Understood.
Secondary hypertension, if we diagnose, we treat the cause,
Uh-huh.
and higher chances that patient may become free of hypertension. Also, it is going to be life-saving for them.
Right. So we understand that hypertension can be a symptom of an underlying issue. But then what are the symptoms of hypertension also?
Right. Very well put. Hypertension sometimes can be a symptom of underlying pathology, and many times we have come to know those malignant pathologies because of hypertension presentation.
True.
And then second part of your question is, what are symptoms of hypertension?
Mm-hmm.
So many times hypertension is diagnosed when patients are coming for a routine health checkup.
Mm-hmm.
So they don't have any symptoms.
Right.
It can be called as an incidental diagnosis.
Right.
And these days, thanks to various practices, various corporates have embedded executive health checkup in their protocol.
Mm-hmm.
So we are diagnosing and catching hypertension at younger age
Mm-hmm.
or earlier age. Because of
Right.
that, we are preventing its complications.
True.
So many times it is just an incidental diagnosis without any symptoms.
True.
However, in some patients, it may present with symptoms such as headache.
Uh-huh.
Headache is there, we check BP and it is in the range of 180, 120 maybe.
Right.
It can also give rise to giddiness.
Mm-hmm.
So whenever someone is having giddiness, it is very important that one should check BP.
Right.
Sometimes patients are brought unconscious
Mm-hmm.
because of hypertension shooting to extreme ranges.
Right.
Right? It can also give rise to nausea,
Right.
uneasiness,
Right.
excessive sweating,
Mm-hmm.
right? Sometimes breathing issues, sometimes discomfort in chest.
Mm-hmm.
So all those can be symptoms of hypertension. If someone is getting that and having very unusual feeling, they
Mhm.
should get their BP checked as the first priority.
Right. And who is exactly at a risk of hypertension?
Right. So to be honest, irrespective of our risk, we all should get our BP checked.
True.
But there are some subsets,
Mhm.
some age groups, some subgroups which are at higher risk of developing hypertension.
Mm-hmm.
Most important, which I keep seeing in my practice, are the ones who are morbidly obese,
Mm-hmm.
who have addictions in the
Mhm.
form of tobacco, alcohol, or narcotic drugs.
Right.
Older age, definitely,
Right.
and patients who are like a lot of undergoing a lot of stress,
Mm-hmm.
because of which their lifestyle, diet, their sleep is disturbed.
True.
So these are common subgroups which are at higher risk of hypertension.
That makes sense. And then is also hereditary contributing to hypertension?
Yes, like all other diseases, hereditary does play some role.
Right.
Patients having their parents diagnosed as hypertensive at younger age
Mhm.
are at higher risk of hypertension.
Right.
So we have to monitor them quite frequently. They
Mhm.
should be aware of their risk.
Okay. Many times, doctor, we hear that diet also contributes to hypertension. So the most important, actually the most popular name we hear is salt. So is salt actually contributing to high blood pressure, or
Okay.
what's the truth about this?
Absolutely, one of the very important factor.
Mm.
Salt consumption, increased intake is definitely one of the very important contributor.
Mhm.
But at the same time, I must say, it's not the only contributor.
Right.
We have discussed a lot of factors:
Mhm.
lifestyle, diet, stress, inadequate sleep, obesity.
Mhm.
These factors together actually
Mhm.
causes hypertension. But salt is something which is there in our hand. We know that salt is very much responsible for hypertension,
Right.
and we should be careful about.
Right.
So when we talk about salt, it's an entire discussion.
Mm-hmm.
How much salt we should take,
Mm-hmm.
what salt we should take. A lot of patients come and
Mm.
ask us, डॉक्टर साहब हम ये सेंधा नमक खा लेते
Yeah,
हैं,
exactly.
हम ये नॉर्मल नमक खाएंगे तो बीपी ठीक हो जाएगा. So
Yeah.
it's not like that,
Right.
right? First important thing is decrease the quantity.
Mm-hmm.
Type of salt is secondly important.
Right.
Then secondly, it is important to have salt which is less in sodium.
Mm.
Thankfully, we have such options these days available. We just
Mm.
have to search them,
Right.
right? Then we have to have salt, if possible, which is higher in potassium.
Right.
Okay, so by using these techniques, we can reduce contribution of salt in our hypertension.
That makes sense. Now I want to talk about the management of hypertension. Firstly, we know that lately everyone at home is able to monitor their BP by using the blood pressure machines. Do you recommend any specific time to check one's blood pressure, or is any time the same?
Okay, so Shreya, management, when we talk about, first step in management is proper analysis or proper measurement of BP.
Right.
Generally, we all take clinic BP, but it's very much obvious and understandable that clinic BP is going to be higher than normal. Why? Because a patient coming to clinic has a lot of things going on in his or her mind, a lot of anxiety. डॉक्टर क्या बोलने वाले हैं, क्या निकलने वाला है, रिपोर्ट्स कैसे है, ठीक है या नहीं है. So it's going to be higher. And you may be surprised to know that this concept is popular worldwide and is given name as white coat hypertension.
Wow.
So many times we have patients who have high BP in clinics. We tell them to observe at home, and BP is normal. So that's known as white coat hypertension. So I want to insist that home BP monitoring is important. HBPM. Home BP monitoring, also known as self BP monitoring, SBPM.
Interesting.
Okay. So then your second question was how to take, when to take. So it's very important that you are taking BP properly, because otherwise it may give rise to false high or false low reading.
True.
So you should have automated digital BP machine which is certified. You should be taking BP when you are at rest, you are relaxed, not when you are rushing to catch a train or when you are rushing to go to your office.
Right.
So that time your BP is going to be high.
Right.
And it's not something you can believe and treat.
Right.
So when you are at rest, this is a practical thing. Many times when patients ask us, in Mumbai everyone is in a rush, especially in morning. So we tell them to take in evening.
True.
When you have back home, you are settled.
Yeah.
You are at rest. So it's important that you are at rest, you are not rushing.
True.
Second important thing is that you have not consumed tea or coffee or smoking or alcohol for last 30 to 45 minutes.
Okay.
Right? Also important, you are not talking on mobile while taking BP. A lot of my patients do that. They are so busy, they are BP measurement is going on and then phone come, mobile is there on the side and they start talking on phone.
Right.
That you should not do while taking BP.
Right.
Okay. Also important is you should be sitting the way we are sitting, with our back supported and hand on table.
Right.
Very well relaxed, rested, and then you should tie the cuff. Cuff should be tied on bare skin and not on cloth.
Understood.
Okay?
Yeah.
And then you should take the reading and record that. If it is abnormal, highly abnormal,
right,
after 2 minutes you should take another reading and discuss with your doctors.
Right.
Okay, whatever I have mentioned, they can make difference of 10 to 12 millimeter mercury of BP. Okay.
And after discussion with doctors, of course, they prescribe medications. Many times patients think that once the BP is managed, they can cease their dosage.
Right.
Is that a good practice?
That's
do you recommend
very important point that we should discuss. That once we have measured, unfortunately, diagnosis of hypertension has come up. So what we discussed in our previous part, that we have to look for secondary causes. Secondary causes are ruled out. Now it is primary, or what I told, essential hypertension. We have to treat with medications.
Right.
Medications we start and then we titrate as per patient's BP and patient's safety profile, how they tolerate, if they are getting some side effect. In general, if we start patient on hypertension medication, they generally have to take it for significant duration.
True.
It just can't be taken and stopped. It's not like fever or loose motion.
Right.
Medicine लिया, ठीक हो गया और छोड़ दिया.
Yeah.
It's not like that. So you have to keep taking BP till the time your doctor advises against it. Definitely you have to monitor it, and some changes in BP medication can happen, but you should not stop taking them altogether without discussion with your doctor.
Of course.
I must say, in our Indian context, very few patients can stop BP medication, because stopping BP medication needs very tight control of BP, which needs very good lifestyle, diet, medications, and lot of changes in the routine day-to-day life. Most of our patients either don't do that or they don't sustain that.
Right.
And what about BP medication? The thing is, if we are taking BP medication and we stop taking it, the BP will have rebound phenomenon.
Right.
We started at 160, BP is well controlled 130. When someone stops BP medication, it may go to 160 and it may also go to 180. It's like a spring.
Skyrockets, yeah.
It's like a spring.
Right.
You have pressed, it may go higher.
Right.
So it's a rebound phenomenon. They land in emergency room with various complications.
Makes sense.
Like brain issues and all.
Right.
So in simple terms, if doctor started you medication after a lot of discussion, thinking the medication was started, you have to take for some significant duration. And after that only, with discussion with doctor, he will or she will advise you that now I think we can withhold the medication.
Right.
Otherwise, we should keep taking medications.
Now that we've understood, how medication can help us, are there any other changes we can do in our lifestyle or diet that can aid management of hypertension?
Yeah, it's very important. Those measures are known as non-pharmacological measures to control hypertension. So I definitely advise my patients not as a replacement to medications,
Of course.
but along with medications for better BP control, these pharmacological measures. First important thing is relaxation therapies.
Right.
Stress, inadequate sleep, a lot of running around all the time on your toes
Right.
contributes to hypertension. So relaxation therapies are very important. Second is diet. There are various types of diets which are recommended. The most common is the DASH. You must have heard about it. Dietary approaches to stop hypertension.
Right.
So to simplify it for our audience, that you should have reduced salt intakes. I'm telling reduced salt, not totally giving up salt. Many times it has happened that patient has totally stopped salt eating and they start getting giddiness. You don't have to do that.
Right.
So you have to reduce salt intake. To be very specific, 4 gram of sodium chloride is something recommended by various guidelines. Some guidelines recommend 2.3 grams. It's too cumbersome to remember. I can tell you some simple things.
Go on.
You should reduce intake of various chips, fries, chutneys, papads, pickles as much as possible. Reduce them from your diet. Stop having munching in between, snacking in between.
Right.
A lot of our patients have that habit. 3 full meals in between chalte firte kuch chatpata churmura. That one should avoid.
Yeah.
Then all those recommended diets advise fruits and vegetables in higher quantity. Then grains, cereals, low fat meat, decrease sugar intake. Now this is also important. We always blame salt, but excessive sugar intake can also pool water and sodium in body and can cause hypertension.
True.
So we should have reduced salt intake. Also, sugar is going to cause diabetes.
Right.
You labeled hypertension as silent killer. Diabetes is another silent killer.
True.
So we already have one. Now we will be having 2. So it's important that sugar intake should also be curtailed. Right. So these are dietary approaches. We spoke about relaxation. Third non-pharmacological measure is weight reduction.
Right.
There is something known as sleep apnea. OSA, obstructive sleep apnea.
True.
Okay, patients having higher weight, obese, they have snoring. So they develop this OSA, obstructive sleep apnea, which contribute to hypertension. So weight reduction can treat that problem and hypertension can be better controlled.
Right.
Okay. Next important thing is physical activity. A routine exercise schedule will definitely help. Then people ask me, what exercise are you recommend?
Right.
Actually, any exercise is going to help. You just have to exercise. People ask and they may not do. So you should do first. And believe me, simple exercise activities such as walking is going to help you. 30 to 45 minutes walk, that too only 5 days a week. Even if you don't do entire 7 days, 5 days a week. WHO has published guidelines. Is going to help you in not only in hypertension, in coronary artery disease, in diabetes, in cholesterol management, a lot
Yeah.
of things.
Overall.
So see,
Yeah.
the simple activities such as walking can help you immensely.
Right.
Okay, this is what I recommend to my patients. So yeah, these things are, I think, non-pharmacological measures. Many times patients, I advise them for patients even before starting BP medication. Especially when they are young, the BP is not too high, they are asymptomatic. So I
Right.
give some time with these strategies.
Right. And this can actually help them manage their BP much better, I feel, if at all they are also borderline sometimes, so that
Correct.
they don't go overboard.
Correct.
Now, one thing, of all the solutions that you have offered, starting from medication if they are diagnosed to lifestyle changes, dietary changes, what is one thing as a cardiologist you wish your patients would just stop doing to help their blood pressure?
It's a tough one, but if you, what you mentioned as a cardiologist, so as a cardiologist, I see maximum problems with smoking. So addiction is something I would like my patients to give up.
Right.
Hypertension is one thing, and I must say one smaller thing. I have seen patients landing with heart attacks and brain stroke,
Right.
CVA we call,
Right.
in a very critical situation. As young as 21-year-old, I have operated upon just because of smoking.
Yeah.
So addiction is something like I would like everyone to give up at the earliest.
Right.
And there are various strategies. Believe me, anyone can give up smoking. I
Right.
have so many patients, though they have suffered from heart attack or other major issues, and they got realized and then they gave up. But you will find examples around you that who has given up smoking, and I think everyone should try and give up smoking or any addiction.
That makes a lot of sense, Dr. Bhargav. Thank you so much for being with us here today. The episode where we talked about a silent killer on Heart Talks. We hope this has been helpful to you so that now you can take charge of your heart health. Thank you so much.